Let's start with good bacteria. The gut microbiome is a complex ecosystem, and it houses good, bad, and opportunistic bacteria. So first we will analyze beneficial or good commensal bacteria. And I'll throw some names such as bifidobacterium, lactobacillus, akkermansia, and many more. So the question is, are they present in optimal ranges for this specific patient, for this specific person? And I have to say that these organisms, they play critical roles in mucosal integrity. Mucosal integrity is how strong your gut lining is and how it protects you from the toxins and outside invaders, outside infections. These good bacteria are also very important in production of short-chain fatty acids, and those short-chain fatty acids are crucial for fiber absorption. Another function of these beneficial bacteria is that they are vital for, you guessed it, your immune health. And as I always say to our new patients, 60 to 70% of your body immunity resides in the gut. So now we're actually looking at the root component of your immunity. The test evaluates the type of beneficial bacteria and their quantity. Is something lacking? Does it have to be replaced? And to jump ahead, I do have to say that I choose probiotics based on this component of the gut test. Then we have opportunistic bacteria. So these bacterial species are normally present in small amounts, but they can become pathogenic. They can become bad when they're overgrown. And again, some of them, the names, Citrobacter, Klebsiella, Proteus, Morganella, among others. And these are not good bacteria, but I do have to point out that bacterial overgrowth is not a bacterial infection. It's still not a good thing, but it's not a full-blown bacterial infection. It's one of these subtle findings that can cause many bad symptoms, from abdominal pain, bloating, cramping, to skin issues, migraines, arthritis exacerbation, and many more. So specifically on the local level, on the gut level, bacterial overgrowth in small intestine specifically can lead to gas, bloating, and nutrient malabsorption. But as I just mentioned, systemically, meaning whole body, it can lead to many other symptoms that are not gastrointestinal. And while this test isn't specific for SIBO, that is a small intestinal bacterial overgrowth, it can raise suspicion when certain patterns on this test are suggested. So next we have pathogenic bacteria. And this is bad bacteria. So we assess for virulent strains that are known to cause acute or chronic GI infections. Those are real infections. And they include these bacteria: Clostridium difficile, toxins A and B included, Salmonella, Shigella, Campylobacter. So now we're talking about obvious infection. It's not just overgrowth. And most of our patients are negative for acute infections, thankfully. And this is actually something that usually has been tested, because it is tested at the local hospital lab. And the key here is that evaluation of subclinical colonization of these organisms that only occurs in a functional testing. So these colonizations can perpetuate low-grade inflammation and mucosal damage, and they create a chronic inflammatory state. So when people come to our clinic and they say, I feel that I have inflammation, actually sometimes they're right, because sometimes we do find types of bacteria that could be the culprit for this inflammation. So just to make it clear, infection is when you have a certain high number, a threshold of bad bacteria, and it's usually checked for and diagnosed at your local hospital lab. The symptoms of infection are usually acute and dramatic, with diarrhea, abdominal pain, occasional bleeding, even fever, chills, and all of that can escalate into sepsis. In contrast with colonization with bad bacteria, you could have this smoldering bad bacteria that may result in some GI symptoms, such as chronic diarrhea or cramping, or not. You may have a chronic brain fog, or arthritis, or headaches, or skin rashes, and that is why it is so hard to get to the cause of some of these symptoms, because they are not gastrointestinal in their manifestation. but they may be gastrointestinal in the root cause. So